My name is Tanja, and I'm a pharmacist by training, and I'm doing a PhD in pharmacoepidemiology at the University of Strathclyde in Glasgow. My PhD is in the field of pharmacoepidemiology, which means we're trying to figure out how drugs are used in the real life using epidemiological methods. So just having a look at who's using drugs and what comes out of that. The impact of my research could be wide, hopefully, because we're trying to improve treatment guidelines and therefore in the end, hopefully improve treatment outcomes. My PhD is in pharmacoepidemiology, so we are trying to figure out about drugs, how drugs are used in clinical practice. The drugs I am concerned with right now are cardiovascular drugs, especially drugs to prevent blood clots. So that's what people usually call blood thinners. So we try to figure out which people use these drugs, how they use it, and what comes out of that treatment. We are trying to figure out these things for these drugs because these drugs are kind of complicated. They have some risks, so bleeding events occur, and people are not really happy using these, but they can really prevent a lot of strokes, for example. So that's why we are focusing on these drugs. A lot of people use them, and many are not comfortable with that, and we try to improve the treatment pretty much. Well, the impact will probably be improved treatment guidelines, because treatment guidelines right now rely solely on results from clinical trials. And clinical trials are not exactly the same way as dealing with patients in real life. So we're trying to make that a bit more realistic, and improve treatment guidelines means that we might change some or might even not, and then just have better outcomes in the end. The best thing about this symposium is actually, I've never been to Manchester before, and we had beautiful weather. I'm meeting a lot of people I've never met before, I like that. And knowing that there are other students out there dealing with similar problems, that makes me feel a bit better, actually. After my PhD, that's actually a bit difficult to say because I don't know yet. I only started last year. I might be heading into academia, maybe teaching. I'm a curious person doing some more research, but I really don't know yet.